Welcome, everyone. My name is Naja. I work at the Canadian Drug Policy Coalition, and today is the first installment of our series, Perspectives on 10 Years in Crisis. We wanted to do a series to mark the fact that in April it's going to be 10 years since the BC's public health emergency was declared. And so we decided that for the next couple of months, we would be having one-on-one interviews with people who have experienced the before, during, and the current moment of this crisis that is not ending, that is worsening. And we're hoping to get some perspective on why it keeps going and how our perspectives have changed and what we can do moving forward. Today, we have invited Lisa Lapointe. Who left her role as the BC Chief Coroner after 13 years, saying she was forever altered by the unregulated toxic drug crisis and discouraged by the government unwillingness to take the bold action needed to prevent the thousands of deaths. So thanks for joining us, Lisa. And Lisa will be interviewed by Jody Patterson, who has been a journalist for roughly 25 years and has been committed to sex workers' rights advocacy as well as trying to stop this toxic drug crisis. So since we have so many people here, I already want to invite all of you to sign up for our next installment of the series, which will be February 11th at 10 a.m. Pacific, 1 p.m. Eastern. It's going to be featuring Denise Baldwin, who will be interviewed by Les Harper, who will be talking about histories of Black and Indigenous harm reduction. So I'll try to keep posting the link in the chat during the presentations. And then if you want to stay up to date, you can follow us on social media. Our Instagram is at CanDrugPolicy, and our website is drugpolicy.ca. You can subscribe to our newsletter. We only have an hour today, so I'm excited to get this conversation started. Thanks everyone for attending. Thank you, Coop Largo, for the interpretation. And Jody, I'll let you start this interview. Thanks so much.
Thank you, Naja. Lisa, I'm very excited to be able to talk to you because you have such a critical view of everything. Can you tell us a bit? You were coroner during 13 really critical years here in BC. I'm wondering if you could tell us a bit about what the role of the coroner is in BC and what it looked like from your perspective as the toxic drug crisis started emerging.
Jody, and thank you so much for the invitation to speak today to the Canadian Drug Policy Coalition. And thank you for everybody who's joined the meeting. I'm here just outside Victoria, BC, and want to respectfully acknowledge that these are the unceded territories of the Wasanic people. You know, it's looking back. When this crisis was declared in 2016, we certainly, those of us in positions impacted by the crisis or positions of authority who were responding to the crisis, had no idea and would have been shocked to know that 10 years later, we are still really not responding in a meaningful way, sadly, to address the crisis. The role of the coroner is to investigate all unnatural deaths that occur in a province or territory, and all unattended deaths, unexpected deaths. So, of course, deaths due to drug toxicity are deaths that the coroner is informed about and that the coroner investigates. Prior to 2012, there were about 300 deaths, 350 deaths per year due to drug toxicity, primarily heroin and cocaine. Most drug poisoning, as we call them now, or toxic drug deaths, are mixed drugs. In 2012, was the very first time we saw the arrival of illicit fentanyl, and I don't think we realized at the time the significance of that. And that was 3 men who died in the lower mainland of BC of fentanyl, who had not been prescribed fentanyl. Fentanyl is an opioid that is used as a pain reliever by prescription, but these men had not been prescribed fentanyl, and they were people who were known to use illicit substances, and that immediately got our attention. from 2012, really over the next decade and to where we are now, we've seen a steady increase in deaths. The last couple of years, deaths have decreased, but primarily fentanyl involved. This is a fentanyl crisis, and not prescribed fentanyl. This is illicit fentanyl. This is fentanyl manufactured in black market. And sold in black market labs. So unregulated, no quality control. And certainly we've seen that in the number of deaths. The province responded, the provincial health officer declared in BC here a public health emergency in 2016. That was Dr. Perry Kendall. That allowed him to compel information from hospitals, BC Ambulance, BC Coroner Service to try to get a handle on what was happening. And that worked well. You know, we do have fairly good data, but you know, we have the data. We know who's dying. We know where they're dying, and those patterns haven't changed significantly. The responses have been a disappointment.
So when did you start to realize that the expected? You said in 2016, everybody who's involved is thinking, "Okay, we're getting on this." When did you start to see that that was maybe not going to happen?
So in 2016, we saw 997 deaths from drug toxicity. And here in BC, we were just shocked. I mean, that was a number that we could have never imagined, almost 1,000 people dying of drug toxicity. And then the number of people dying increased and increased. And the number of people experiencing poisonings and being treated by ambulance and being treated in hospital was increasing at the same time at a significant pace. In 2017, so the chief coroner has the ability to bring together what we call in BC a death review panel. Some other provinces have those, where we bring experts because coroners don't have expertise in everything. So I brought in a panel of experts, and it included police, it included public health, every medical health officer of the 5 health authorities in BC, included the First Nations Health Authority, included Ministry of Education and Ministry of Labor, and all of those who could play a role in responding, and said, look at the data. Here's all the data about the people who are dying. What do we do? And they came back with some really great recommendations. And the one that, to my mind, was the most significant and remains outstanding in terms of response is to regulate treatment, to establish provincial standards for treatment in our province, and to require outcome reporting for treatment. That has never been implemented, and to date, we still have no standards for substance use treatment, residential treatment, in fact, anywhere in the country, and nor do we have outcomes for treatment. And yet still so many folks involved in this crisis, policymakers, they keep talking about treatment as if it's very simple. And all we need to do is provide treatment and the crisis will be over. Well, 10 years in, we can see that that's been really a really naive response.
And also it's sort of confusing to me why when you do hear a lot of political talk about treatment, the importance of treatment, even forcing people into treatment, why would they not be in favor of regulating treatment?
Is the question of all questions, Jody. And honestly, to date, I don't know. And I have never been provided a good response. Certainly our government here in BC, and I've heard other governments across the country, they rely heavily on funding treatment beds. But it's really hard to get information about what is the effect of a bed. So here in BC, the province has added since 2017 682 beds, but they don't talk about people. So how many people does that assist? And of those people who have accessed those treatment beds, whatever they may be, what have been the outcomes for those people? Have they been able to complete the treatment? And have they survived? Frankly, because as chief coroner, I know many, many, many of those who died had been through treatment, and not just once or twice, often several times, because substance use disorder is a relapsing condition. It is a health condition. There's universal consensus on that. And it is a very complex, challenging health matter. People relapse. And sadly, if you have a treatment system that often is focused on abstinence, people relapse, they use a substance, and they die because they are more vulnerable. People who use opioids and then stop for in as little as 3 days, their ability to tolerance for the opioid is lessened, and they are at greater risk of death. So, I often wondered, well, A, we don't have good data about the number of people who have received this kind of treatment. B, we don't know what their outcomes are. And C, in some cases, has it actually made this crisis worse because we have made people more vulnerable? And then other things that are very challenging is that even if somebody can get into publicly funded treatment, which in this province is very, very difficult, as I say, there's 682 publicly funded beds. There's 225,000 people at risk. That's the estimates of one of our death review panels. There are lineups, as I'm sure you've heard, and many of those, here today will have heard. There are lineups for every form of treatment here in our province, voluntary treatment. Even if somebody manages to complete treatment, then what's next? And families certainly have told me they're paying out of their pension funds, their retirement funds, selling their houses for, for counseling for their loved ones, to provide the supports that just don't exist because a 30-day or 90-day or even a 6-month, treatment. These are long. This is a complex, long-term challenge when people are struggling with substance dependency.
And when you're talking about like treatment, of course, there's many other things that can happen for people that aren't this thing called treatment, especially like bed-based treatment. But there's another question, like the substance. Everyone knows that this is a relapsing condition. Everyone understands it as a health issue in theory and research and evidence. And yet, unlike all the other health issues, it isn't treated that way because of the criminal element of the substance that is, in play here. What do you see about that? Like, what could we be doing so much better?
That's such a big question, Jody. I could talk about that for the rest of the day. But one of the huge challenges, of course, is that the Controlled Drugs and Substances Act, which really is a form of, comes out of the Opium Act back in the late 1800s, and was never evidence-based. And I think people have this impression that somehow, our drug laws are evidence informed. They never were. They were in fact grounded in racism. They were primarily directed at Indigenous people and people who were using heroin, often, culturally, people from Asia. So they were never based in evidence, and yet they've continued to, hang on, reiterate year after year after year after year. And what's happened, in my opinion, after being involved in this crisis for so long, is that the efforts were really made by governments over decades to villainize people who use drugs, to other them. And so that's one of the challenges in now acknowledging that this is a health issue, is battling that perception that we're somehow dealing with criminals or people who aren't like us. And I can tell you, having investigated or reviewed the investigations into thousands of deaths, into people who've died as a result of drug toxicity, they are people just like us, and these are our family members and our neighbors and our colleagues, and yet somehow that image persists that they're bad people that we don't want in our neighborhoods, and it's really disturbing. And yet, here in BC, we had this, reduce stigma campaign by the government. And yet there's a part of me that thinks government has been one of the worst offenders at stigmatizing, because in any other health crisis, as you point out, at one point we were losing 7 people a day in our province to toxic drugs. Now, currently, thankfully, the number of people dying has dropped, but we're still losing almost 5 people every day to drug toxicity. It's hard to imagine any other cause of death that government wouldn't have mustered every tool that they have, every expert that they have, as many resources as it needed to address a crisis. And they haven't. And so that's why I'd say, I have to think that honestly, government is as guilty as anybody of stigmatizing people who use drugs. And I should say, and then I'll let you get to the next question, people use drugs for a variety of reasons. Oftentimes it's pain, it's trauma, it's acquired brain injury, it's as different as people are the reasons why people use drugs. And it's very easy to become dependent on opioids, and it's very hard to move away from drug use once you have become dependent because of the receptors in your brain. This is a very complex health challenge.
So it would seem to me, like as an outside observer, that you being the coroner was like a piece where you could really move things, and yet you chose to leave a couple of years ago, perhaps to move into a world where you felt like you could push harder or differently. Is my perception right? Is that what you did?
Certainly left feeling very frustrated. So
Mm-hmm.
as chief coroner, I directed 3, what we call again, death review panels here in BC, really dedicated professionals who had expertise. We didn't make recommendations without evidence. So we brought together the experts. They looked at the evidence. They looked at best practice across the world. And those experts came up with some excellent recommendations. And we shared those recommendations with government. So 3 different panels. Some of the similar agencies were involved in all 3, but they weren't handpicked to conform to a certain ideology. They were the people in power, the medical health officers for every health authority. People who knew what they were talking about, and government just didn't take up those recommendations, didn't respond to those recommendations. So. Yeah, it was very frustrating. I didn't leave for that reason. I had always intended to retire at the end of my 3rd term. I had been and still am the longest serving chief coroner in BC, and I think there's always a good time to leave and let new people come in. And I've certainly maintained my involvement in this area.
So 10 years on, here we are, 10 years on. Where are we going with this? Like, what are you feeling? Do you have any encouragement of anything? I'm
Certainly,
looking for hope here, Lisa.
Yes, certainly I'm involved and coordinate with a number of really valuable groups. Doctors for Safer Drug Policy here in BC, Mums Stop the Harm, the Canadian Drug Policy Coalition, and there is some excellent work being done by some really excellent people with great knowledge and expertise. Our own provincial health officer, Dr. Bonnie Henry, released a report a couple of years ago that it reiterated the recommendations of the death review panels. And one of the things that's been most controversial, and I apologize, I forgot to plug in my laptop, so I'm going to do that while I'm talking, has been the recommendation for what is colloquially known as safer supply, or pharmaceutical alternatives to illicit drugs. Because what our 2nd death review panel members told us very clearly was that until people were able to separate from the toxic drug supply that they were dependent on, or that they were using, we weren't going to be able to address this crisis in any meaningful way. And that's because we don't know we don't have good evidence about abstinence-based treatment. We certainly couldn't ramp up the treatment in the volume that is necessary. Here in BC, and I know in many other provinces, in fact, I think every province in the country, healthcare access is very challenging. Like treatment for substances, very hard to access, timely, medical care when people need it. And in a province that's struggling to provide people with a family doctor, we were never going to be able to provide treatment for 225,000 people, never mind the fact that we don't have evidence about what is most effective, and many people relapse, so would need to go through multiple times. So there were some pilot pharmaceutical alternative programs funded by Health Canada that showed really, really promising results. And Health Canada published those results, in terms of reducing dependence on the illicit market, fewer deaths, fewer arrests, just less social disorder connected to better health outcomes for people, because when they would come to the safer clinic to get the drug that they were being prescribed. It was a prescription model being prescribed. They could connect with healthcare providers. They could help get their ID back. So that those programs were really, really successful. Now, I must say, and this is something that I think a lot of people don't understand, there's this belief that all of those who are dying are our most vulnerable people, people who are living unhoused or precariously housed in the downtown east side of Vancouver or other neighborhoods across the country. And certainly those populations are the most vulnerable in terms of the rate of death in those populations is very high. But here in BC, the majority of people who are dying do not live in the downtown east side or here in Victoria, Pandora Street. Most of those who are dying in our neighborhoods across the province. They're dying in middle class neighborhoods and upper middle class neighborhoods and rural neighborhoods. And drug toxicity is not a condition or a health matter that's confined just to people living precariously. There are thousands of people, and 225,000 people in our province using drugs, and many of whom are dependent on drugs. And to be able to access a safer supply program, they were very limited. They were only in urban areas, and they were only for people diagnosed with substance use disorder, and many people just would not access them. So of the 225,000 people at risk here in BC, that was an estimate from the 2022 Drug Death Review Panel, there are currently 2,900 people in our province who can access a pharmaceutical alternative, despite the fact that evidence has demonstrated that they have been extremely effective in helping people to wellness, keeping people alive, first of all, but helping them stabilize, connect with family, and become healthier.
So you raise another interesting issue around what is basically a political reaction to a health issue. And again, you're seeing that in the States right now, the politicization of certain health conditions, but we haven't had that in Canada. We don't have the politicians deciding how breast cancer will be treated in the sense of, no, shorter radiation time and no surgery, they don't interfere. How do we get them out of this issue? Why are they in it, and how can we stop that piece?
It's very challenging to change ideology. And I think, that's one of the things that I have found most frustrating is that this so many people think that punishment is the way to go. And of course, our history shows us that criminalizing drugs and people who use drugs has been seen as the most effective response. Well, we've seen that that's been a failure. In fact, more than 50,000 people have died of drug toxicity in our province in our country, since 2016, under a criminalization model. The small pilot programs across the country where people were able to access pharmaceutical alternatives, monitored, regulated, carefully, showed real great promise, but it's hard to get over this ideology that we don't like drugs and somehow equating support for a safer supply program or pharmaceutical alternatives with promoting drug use. And of course, that's not what it is at all, but it's recognizing that 50,000 people in our country have died of drug toxicity. The only people, frankly, benefiting from the current model, well, there's two: organized crime and some of these private residential treatment centers who are charging exorbitant amounts to families who are desperate to help their loved ones become well without any evidence that those are effective. It's really deeply ironic that those are the things that keep being touted as the response when there's no evidence to support that. And yet the measures that evidence has demonstrated to be effective: harm reduction, the widespread availability of naloxone, overdose prevention sites here in BC, safe consumption sites, here and in other places. Those have saved thousands of lives. And yet there's so much controversy. Whomever can come up with the answer to how do we change the public's heart and mind on this issue, they should win a Nobel Prize, in my opinion. But because it's incomprehensible to me that people just do not want to look at evidence. And that's the real paradox, I think, of the toxic drug crisis. People want to do what they think will work. Well, just arrest more people, even though it's never worked, but they think it'll work. And yet, and I do want to say, the provision of safer supply, pharmaceutical alternatives, harm reduction measures, needle exchange, all of those measures, all of those need to be part of the response. Access to healthcare, access to mental health care, reducing poverty, stable and secure housing. But those are long-term things, and governments sadly exist in periods of 4 years. And those things don't make splashy headlines. But when you have people who see a problem, a quick fix seems like the answer. Well, we'll get more police. We'll involuntarily commit people, even though there's no evidence to support that as a meaningful response to substance dependency. But the public falls into that trap of, oh, the government's doing something good, that'll take care of the problem.
Yeah, I've also find it interesting in the first hard pushback on safe supply was the death of a young woman who had ostensibly acquired drugs through a safe supply, somebody who had brought it into the illicit market. But the comparison there was to a world with no drugs, where children can't access any drugs. And look, safe supply has allowed her to access it, when in truth, they can access it so easily, right? Like would you like your child to access the drugs that at least somebody has actually, made in a real way with correct dosage, or would you like them to access this crazy street supply? But again, the stigma just seems so huge that we can't get out from underneath it. If Lisa Lapointe is now running the world, or at least BC, what would you do? What would you do to make this, to start to set it right?
Well, I pick myself up off the floor first because I'm shocked. But what I would do is I would try to bring together all of those impacted by this crisis. So that includes people who use drugs and their families, because they have such an important voice, and far too often they're not heard. I would push police a little bit further in the background. Police do a great job on many fronts. They are not health experts. And for far too long, police leaders have occupied, in my opinion, way too much space on this issue. They are not health professionals. And I can tell you, in speaking with the Doctors for Safer Drug Policy here in BC, they are extremely frustrated. They want to be able to treat their patients as they, to the best needs of their patients, the individual needs of the individual patients, and not be hampered by policy and restrictions. So I would shift the focus. Everybody acknowledges this is a health issue. I mean, if it's not a health issue, then why does the Controlled Drugs and Substances Act even exist? I think it's because somehow our legislators think, well, that's how we're going to keep people safe. It hasn't. It's a health issue. So let's focus on the attention and the resources on the health response. And that's what we're missing, because we've criminalized drugs. And again, I want to stress, this is not about promoting drug use, but it's about recognizing that if people are going to use drugs, how do we reduce the harms? How do we, help them move away from that drug use? And where is the prevention? Where are the prevention efforts? So, as I said earlier, funding health resources for folks who are so many people are on waiting lists just for healthcare. Mental health supports are seriously lacking. Addressing housing challenges, and then being honest with our youth in the schools. One of my daughters is a teacher, and it's not part of the curriculum.
No.
In BC, we've been in this public health emergency for 10 years, and we're not having honest conversations about drugs. So I know Guy Falicella, who is a person with lived experience. He's no longer using drugs and is a fabulous advocate for people who use drugs and a meaningful response to the crisis. He speaks all over the province and all over the country. And he provides that really reasonable, we're talking about people. We're talking about people who are hurting. We're talking about people who are experiencing harms. How do we help them? That really compassionate, respectful, what do people need approach. That's what I would shift. And, I'm nothing against police officers. We need policing for various things in our province, but all of the resources that are expended in that direction, I would shift towards healthcare and mental health supports.
Part about the not being in the schools, there's a group called Nalox's Home in Vancouver who do training in the schools. They've talked to 40,000 grade 8 to 12 students. She does a little survey at the end of each session asking, the basic questions. What did you learn today and all of that? And more than half of the kids have no idea that there was a toxic drug crisis. So these are kids who have grown up in the toxic drug crisis, right? These years. That is a piece to me that really needs to be, how can we, when you talk about prevention, there's many kinds of things that would have to come into that. But any thoughts on why we wouldn't be in those schools doing not the old DARE stuff, but something more meaningful?
Yeah, definitely not the DARE stuff, because research indicated that scaring people straight was the old scared straight, not effective. Educating children, having honest conversations about kids like they do now, or they try to do around sexual health. Nobody talked about that when I went to high school a million years ago, and there were a lot of unplanned pregnancies. There were diseases got transmitted because people just didn't know. And I think the theory was, we don't talk about it, they won't do it. Of course, that's illogical. So and again, calling on our governments to implement communications plans that come from government. How do we inform not only students, but the general public? And so often, I still do a lot of public speaking on this topic. And so often people come up to me after and they've lost someone and it's heartbreaking. And they say, I didn't pay attention to this issue until my brother, sister, parent, son, daughter died. And then they get involved. And I think there's maybe this sense that there's only a small number of people at risk, and they're those outlier others, and that's what people need to understand. Everybody's at risk. I mean, frankly, people can become dependent after suffering a workplace injury. And then the prescriber stops their prescription, and yet they're having lingering pain. Next thing you know, they're taking street drugs. Somebody lands them. Their drugs diverts their drugs. That's the most common kind of diversion, is people who have had a prescription saying, here, this, my doctor gave me this, I don't need it anymore, you take it. So I think that's one of the things that we need to acknowledge, is that people come to substance use from all walks of life, and for all sorts of reasons, and we just need our governments haven't done a very good job of communicating that, and because of the stigma, because of the criminalization, people don't come forward. Their loved one dies, and oftentimes people don't want to share their cause of death with anybody. There's for no reason. There's still shame involved, and there shouldn't be. Those are really some of the challenges that we have around this issue. And I mean, certainly when I was in the role, I pushed back really hard. There's a culture now, I think, I don't know, across the country, sadly, where we seem to be going back to this conservatism. Hardline compassion is not in favor anymore, and I that makes me very scared.
And what's really interesting too is it like a small c conservatism that crosses all political ideologies, right? Like I can no longer think of a party that has my heart around this issue, right? Like it's like all of them have turned away and gotten harder. So not to, end this in too much of a bummer tone, where do you find the points of hope? Like, where do you mentioned Moms Stop the Harm, you mentioned Doctors for Safer Drug Policy. Those have both emerged, much more strongly anyway, throughout this crisis. And they're, changing the dialogue. Where else? What do you see?
Yeah, I mean, certainly organizing is most effective in terms of getting messages across, but any person can write their MLA or their MP and let them know their views. Any person can write to the editor of a newspaper and say, your reporting offended me. But one of the things that we found early on in the crisis is that the language around drug use was really offensive. So we used to talk about people getting clean. Well, the inference was before that was the opposite of clean.
Yeah.
People talked about, and I even hate to use the word addicts, drug addicts. No, there are people experiencing problematic substance use. There are people sometimes in a health crisis. So it's about this sort of people first. And I think we all need to change our language. I think we can set that example in our conversations that we have with people. And write our MPs, write our MLAs, join an organization like Moms Stop the Harm. You don't have to be a mother who's lost somebody. I joined the organization after I retired. Great organization. And provides help and advocacy for people who have loved ones who are experiencing harms. I sit on the board of PHS, which is a housing provider here in BC. Certainly, we've drafted policy papers in support of pharmaceutical alternatives and in recognition that people need basic health care. First and foremost, housing and health care, if we're going to support people to wellness. And I just keep, I say this over and over and over, criminalizing people has never worked. In fact, if you think about it, if you want to support somebody to wellness, and now you're arresting them, and now they have potentially a criminal record, although I know the prosecution services is not prosecuting possession. But reminding those in positions of power that response has never worked. And let's look at the evidence, and the evidence has shown us that, in fact, pharmaceutical alternatives do work. Harm reduction does work. Guy Felicello often says it's the opposite of addiction is connection. Connecting people, people struggle, and we have a lot of great connections for people, official ones, government funded ones where they can go for counseling when they need it. Anywhere in our province, anywhere in our country, those aren't available. We shouldn't probably be surprised, sadly, that so many people are dying because the current legislation and policy has meant that drug traffickers, and I'm not talking about the individual street people who often sell drugs because they need them, organized crime drug traffickers, they are making billions off the vulnerabilities of our citizens. And it's just shocking to me that we've allowed that to continue. Governments need to regulate drugs and have prevention strategies and all of the other measures that we need to help keep people well.
That to me feels like a very natural segue into the Q&A portion. But is there anything that we didn't talk about that you want to make sure to mention?
Thanks, Jody. It may come up in the Q&A. I'll just say one thing. In BC here, we've had a 3-year decriminalization pilot.
Sorry, I have to interrupt, Lisa. We're having issues with your audio. That happens when we have live events. Do you mind checking maybe your connection? If not, yeah, people are suggesting in the chat sometimes cutting the video might affect it, but let's just take a minute just to see if we can resolve the issue.
Okay, so is that better? I replugged my. Is that better, Nathan?
No, could you try maybe turning off your video? Sometimes that helps. Oh, you're muted.
Turned off my audio instead of my video. All right. How's that? Is that better?
Yeah, that's better. Thank you.
Good. So I just wanted to say that this 3-year pilot, which is ending at the end of January, I have heard people say it has been a failure, and I really want to push back on that. So I'm not sure what metrics they're using to deem something a success or a failure, but in the 3 years since the pilot started, we've seen a significant reduce in deaths in BC. We've seen a significant reduction in people arrested, a significant reduction in drugs seized by police, reduction in ambulance calls, and no increase in people diagnosed with opioid use disorder, including amongst youth. And that was the big fear, more people will use drugs. All of those indicators, which are data driven, say to me that this pilot was a success. I think even if we decriminalized and nothing got better, but nothing got worse, I would say it was a success. It would demonstrate that criminalization isn't adding anything to addressing the crisis. But indicators are that things got better. And yet there are still so many people who want to say it's a failure. And oftentimes that's because they are saying they're seeing more public drug use. There aren't data around that. But we also have a housing crisis, at least in our province. And we have thousands of people living unhoused on the streets of our cities. And I can't help but wonder that, people are conflating the housing crisis with the decriminalization pilot and unfortunately drawing the wrong conclusion.
Yeah, that's so true. I hear people complain about open drug use. Well, if you're homeless, the reason it's open drug use is because you don't have a house, right? Like again, the language around some of that is very inflammatory and designed to provoke a kind of a strange reaction with people to feel even more against anyone who uses substances, even though they are using substances in the comfort of their own home. It's a very strange dynamic we've got going on.
Yeah.
Lisa,
Agreed.
that was such a great conversation. I believe we're going to open it up to questions from participants. Have I got that right?
Thanks, Jody. And I'm going to try my video again, and Naja, just tell me if it's not working when if my audio is affected. I live in a somewhat rural neighborhood, and sometimes internet isn't as good as it could be.
It's looking good for now.
Okay.
So we'll do the
Fingers
Q&A
crossed.
section with your.
Fingers crossed.
Thank you.
So,
Naja, do you want, how do we do the question and answer? Do I do that or do you do that?
I'm happy to ask
Okay.
the first question to open. So the first question is really a sentiment that is echoed throughout the chat and in the Q&A. And so I'll read one variation we got of this question from Tristan, which is, when the coroner has been ignored, when we've had dozens of committees, panels, report that are ignored, when our marches have been ignored, and harm reduction and safer supplies continue to be pushed out in favor of for-profit, unregulated treatment system, what do we do? What is next? People are really asking about, we're pushing from every direction. Have we pushed enough? Why is this? Why are people getting appointed into positions? Why is research being funded and then being ignored? So we're getting a variation of this question. I'm curious, Lisa, what do you think about this?
Yeah, it's certainly the frustration that I felt, over the last several years as chief coroner. I know in my province, myself, the representative for children and youth, the provincial health officer, the ombudsperson, everybody was on the same table that the changes that needed to be implemented needed to be evidence informed initiatives, and we needed to move away from this criminalization. Police were on board. And I'm not sure why it shifted. Certainly, as I said earlier, there's this conservatism that seems to be taking over things. I think all we can do, which is a lot, is join together, join an organization, and then those organizations need to organize to push back. The voices need to be heard. The people who complain about public drug use, it's always anecdote. And policy shouldn't be based on anecdote. It should be based on evidence. The evidence has demonstrated what is effective in addressing this crisis. And we need to be pushing that evidence, demonstrating over and over and over to those in places of political authority. This matters to us, first of all. And
sorry, Lisa, I have to turn your video off again. Thank you.
Yeah, that this matters, and push people in elected positions to make the changes. Because, I mean, in our province, write David Eby. Frankly, he's the premier of BC. Write him over and over and over and over. And I can tell you, having been in government for 30 years, they do listen to, when they get a bulk of letters on the same topic, attention is paid. And I think right now, the wind sadly is blowing in the other direction. But don't not raise your voices. I think that's really important.
Thank you, Lisa. So in the same thread, there's two questions that I want to get to. There's one question by Beverly and one question by Zoe. I think there's a nice segue with the question by Beverly, which is that you've said that you left the role forever altered. Could you speak directly to your earlier self on the day you assumed the position of chief coroner? What hard truth about the limits of evidence in the face of political inertia would you now insist that your younger self truly understood?
That's a complicated question. I think certainly coming into the role, I had no idea that I would be involved in a public health emergency a couple of years later. I assumed the role in 2011. The public health emergency was declared by Dr. Kendall in 2016. I think we did the right thing in terms of holding death review panels, bringing together the experts, sharing the recommendations with government. I did a lot of media, and I think that really helped in that whenever we had updates around the number of people dying, when we had updates around the recommendations from the death review panel members, we did a media event, and that honestly, I think that really made a difference because media were very interested, and they would come and we would be able to get our message out. There's a bit of a cone of silence around this issue now, in at least in BC, and I'm not sure how other governments are dealing with it. And so I think I would maybe be a little bit more strategic in terms of, we certainly had a great coalition of experts supporting the recommendations that we were making. I think maybe I would be a little bit more strategic around our communications with the public. We expected our government to do that in terms of letting the public know how things were going, and they just never did. So there's a great deal of public misunderstanding and misinformation that I would address sooner.
Yeah, not only that, also the communications from the government has been to rally people against homeless people and make them the face of drug use and kind of like the culprit at the same time. It's been pretty grim. So that's I think that's insightful. That we should build that communication from the ground up and not expect our governments to do so, because it seems that their strategy has been to pit people against each other and scapegoat people. And if there's anything, scapegoating of our most marginalized communities have been the theme of this political circus that we've been witnessing. So I think thank you for this answer. I think we have time for a last question by Zoe Dodd, which is, could you speak to the gagging of chief coroners and chief medical officers of health in Toronto or elsewhere? How is BC different from ours that you were able to speak up? Do you speak to them there? They closed safe injection sites in Toronto, and their office was tasked with closing them. Deaths have gone up, public use has gone up, paramedics responding has gone up, as we had all predicted. Could you speak on this? Oh, correction from Zoe. Oh, my bad. I said Toronto, Ontario, actually.
Yeah, so I think firstly, across Canada, and there is a forum of chief coroners and chief medical examiners that has an annual in-person meeting and is in regular contact. So, lots of discussion across the country amongst that group, and a shared understanding of the challenges and the breadth of the toxic drug crisis. But the office of the chief coroner in every province and territory reports to a minister within government. So, and governments are funny in that when you take on a government role, one of the things you do is you swear an oath to support the government. So you've got this tension where you are not an independent officer of the legislature. You're not appointed by a legislative committee. And I know this is a bit technical, but officers appointed by the legislature have independence of government. They set their, they have a budget, but they operate independently. They don't have to report to a minister. Chief coroners, chief medical examiners report to a minister. So the hierarchy of that is difficult. They are not independent officers. And so there is a certain need to be strategic in your communications. Now, for me, as the the longer I was in the role, and the longer the crisis went on, and the more people that were dying in our province, and the grief that I was seeing across communities, I really got very close to the line in terms of what I could say publicly. Our Coroners Act allows the chief coroner to bring the findings of coroners' investigations and death review panels to the public and to prepare messaging to the public to support public safety. And I really took advantage of that section of the Coroners Act. But Zoe is right. There is this very much this cone of silence around this issue. And what I often say here in BC is government has adopted this nothing to see here. But look at this. Look at the beds that we've funded. And they'll talk about the people that have been helped, but look at the beds that we funded. Look at the money that we've spent. And now look, we're going to involuntarily detain people, and look how much we're doing. Sadly, journalists are becoming fewer and far between. We need to call governments on that. And when they talk about beds, we need to ask them about people. And when they talk about involuntary treatment, we need to demand the results of that. Who, not personal identifiers, how many people, what are the results? Because, for that particular initiative, research has demonstrated over the years that it is completely ineffective.
Thank you so much, Lisa. We're about at time, so I just want to leave the floor to you, Jody, and you, Lisa, if there's any final thoughts before I do my little closing message.
Thank you. Thank you for the opportunity to speak. Thank you for those who attended. My apologies for the audio challenges. It's the problem from being retired and working at home. But I just really appreciate everybody caring about this issue. So thanks for the opportunity.
And thanks so much, Lisa. You were, as always, so informative. So, I don't know, just you've got passion, but with you've got evidence-based passion. I like that. And thanks to everybody. It's been really nice to see all the little hearts out of the corner of my eye as we've been talking.
Agreed. Thanks, everybody.
Thank you, everyone. Thank you, Jody. Thank you, Lisa. Thank you to Coop Largo for the interpretation. I will post again the link for our next installment of this series in the chat. And thanks everyone for attending, for keeping the conversation and the comments fired up, but also respectful. My attention span was really challenged by listening to the conversation and reading the chat, but I had a great time. Really enjoyed everyone for showing up and participating. And we are finishing right on time. So yeah, I will see you next month. Hopefully, everybody have a great day.
Thank you.
Take care.
Take care. Bye.